This stretch I'm going to demonstrate is a stretch for the front of the thigh or the quadricep muscle. And you've probably seen people doing this, say, before going on a run. You'll see people in this position. So there are several components that we need to get right in order for the stretch to be effective. So first, let's talk about what we're really stretching. So the quadricep is made of 4 bundles of muscle. So 3 of them attach to the femur, so they get stretched simply when the knee bends. Okay? The 4th muscle actually attaches to the pelvis, so it crosses the hip joint. So it will only be stretched when the hip is extended. So what we want to do is grab at the ankle. You don't really want to grab the foot. You can get a little more leverage at the ankle. And so we're going to pull the heel up to the butt. And now the other thing we're going to do is pulling with the arm and using the hip muscles. We want to extend that hip so that we have a straight line from the knee to the hip and to the shoulder. So some people, if the muscle is really tight, they may need to use a belt or a strap to reach the ankle, and that's just fine. And as it loosens up, when you can get the ankle, that's perfect. So a very important component to really control is the pelvis. Now remember, we said that the muscle attaches to the pelvis, so when it's tight and you pull on it, it will want to pull the pelvis forward so that the low back arches. So we need to use the tummy muscles to flatten the back. So if we imagine that the waistband of your pants is a cup, it's like we're trying to dump water out the back of that cup. And you want to hold that as you do the stretch to be effective. Now the third component involves the tissue on the side of the leg called the iliotibial band. So when it is tight, what you'll see is the knee out to the side. And getting back to the rectus femoris, which is that part of the muscle that crosses the hip, you'll see people stretching, they'll stop with this hip flexion because it's quite rather uncomfortable when it's tight and you're stretching it. But that will get better with practice and doing this consistently. So we want to squeeze that knee in next to the other one. If we bend this knee slightly, you can even squeeze in behind to, as a bonus, stretch the ITB as well. So you can hold the stretch 10, 15, 30 seconds more. So if you're stretching less intense, you can hold it longer, and there's definitely merits for that. But you can also really get after the muscle and only do it for 2 to 3 seconds. So longer stretches you can do 2 or 3 times, several times through the day. But the shorter ones are actually handy, say you're in line at the store, or you're waiting for something to heat up in the microwave. Go ahead and give it some real intense pulses into the discomfort, and actually that adds up very quickly throughout the course of the day. So your goal is, when this muscle's tight, like I said, it's quite uncomfortable to stretch. We're trying to make that discomfort go away. I usually tell people, if you're tempted to make a face when you're stretching a muscle, and it doesn't really matter what muscle it is, as long as the force is reasonable, it probably needs some attention. So this muscle does like to get tight, especially if you're up on your feet a lot, running, doing a lot of exercise in the gym using weights. So just monitor it. If it just feels like a stretch, just a minor pull, probably doesn't need a lot of stretching. But if it's starting to feel tight, then certainly double up on your stretches for a while until it's back to where it needs to be.